السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 3 in infection control and number 6 in Ghaith review. Today we are going to discuss 5 questions from question number 54 up to question number 58. معكم محمد عثمان. هي نبدأ مباشرة. Question number 54. A 5-year-old child is seen in the primary care clinic with mild fever, headache, and malaise for about 2 days, and today he has a rash filled with fluids. Which of the following is the best suggested diagnosis? The options are number A, chickenpox, number B, German measles, number C, measles, number D, scarlet fever. وقف الفيديو هنا واختار الخيار بالشيء السهل. The correct option is option number A, chickenpox. اللي اخترنا الخيار رقم A نشوف rational. Chickenpox is a highly contagious disease caused by varicella zoster virus. The classic symptom of chickenpox is a rash that turns into itchy, fluid-filled blister like this. So the correct option is option number A, chickenpox. The remaining options are incorrect because fluid-filled blisters are not among their signs. So the correct option is option number A. Question number 55. A 8-year-old boy present to the pediatric clinic with his mother, who complains that the child has developed a skin rash. There is a clear drainage from the nose, and he appears tired. The rash first appeared on the face and then spread over the trunk, and is now beginning to appear over the hands. Some lesions show open ulceration, and others have crusted over. There are scratch marks over the skin, which finding would indicate the child is ready to return to school. The options are number A, normal body temperature, number B, dry and escaped lesion, number C, nose of 3 of drainage, number D, absence of rash over the trunk. وقف الفيديو هنا واختار الخيار بالشيء السهل. The correct option is option number B, dry and escaped lesion. ليه اخترنا الخيار رقم B؟ نشوف rational. Anyone with chickenpox should remain isolated from other people until all the spots have crusted over or until the last blister has escaped over. So the child will be ready to go back to school once the last blister has escaped over. So the correct option is option number B, dry and escaped lesion. Question number 56. A patient with measles, rubella, is on airborne precautions. Which of the following precaution technique will be essential to implement for non-immune person entering the room? The options are number A, gloves, number B, gowns, number C, masks, number D, face shields. وقف الفيديو هنا واختار الخيار بالشيء السهل. The correct option is option number C. ليه اخترنا الخيار رقم C؟ شوف rational. For patient under airborne precautions, the nurse should wear a fit-tested, seal-checked N95 mask when entering the patient room. So the correct option is option number C, mask. Gloves, gown, and face shields, they are not preventing airborne transmission disease. So the correct option is option number C. Question number 57. A home health nurse has entered a home to complete an admission assessment on a patient who has a methicillin-resistant Staphylococcus aureus (MRSA) urinary tract infection. The patient will receive intravenous anti-infective via a peripherally inserted central catheter (PICC) for 3 weeks. Which of the following action should the nurse take first? Number A. Check the patient hand. Number B. Place the nursing supply on a clean, dry surface. Number C. Obtain the patient's written consent for home health care. Number D. Perform hand hygiene per the agency protocol. وقف الفيديو هنا واختار الخيار اللي تشوف سهل. The correct option is option number D, which is perform hand hygiene per the agency protocol. ليه اخترنا الخيار رقم D؟ نشوف rational. MRSA, methicillin-resistant Staphylococcus aureus, is a type of staph that are resistant to the methicillin. It transmitted by direct contact or contact with contaminated items. The priority here is preventing transmissions of methicillin-resistant Staph aureus infection by using contact precaution, which include hand hygiene, PPE, and patient placement, equipment management, and etc. So, the first action that the nurse should take is performing hand hygiene per the agency protocol, which is the correct option. Question number 58. You have just admitted a patient with bacterial meningitis to the medical surgical unit. The patient complains of a severe headache with photophobia and has a temperatures of 102.60 Fahrenheit. Orally, which type of isolation should be suitable for the patient? The options are airborne, number A, number B, contact, number C, droplet, number D, standard precaution. وقف الفيديو هنا واختار الخيار اللي بتشوف سهل. The correct option is option number C, contact precaution. اللي اخترنا الخيار رقم C نشوف rational. Bacterial meningitis is the most serious type of meningitis. It can lead to death or permanent disability. It is a medical emergency. Several types of bacteria can cause bacterial meningitis, including Streptococcus pneumonia and group B Streptococcus. The disease transmitted from one person to another through a tiny droplet from an infected person's mouth, throat, or nose. Therefore, patients should be placed on droplet precaution, contain private room, mask for all entering the room. So, the correct option is option number C, which is droplet precaution. شكرا جزيلا. Don't forget to support us by comment, like, or subscribe.